Hi, my name is Taylor Ford, and my presentation is effects of stigmatization, which is a type of social rejection. A stigmatized person is discriminated or ignored altogether. I will be discussing my research article, which is the sociological study on stigma among tuberculosis patients in Delhi, and I'll also be discussing the cause of stigma, the impact and effect it has, and the ways stigma can be reduced. The purpose of my research is to assess the effect of social stigma in tuberculosis patient treatment, their personalities, emotions, feelings, changes in the way they think, and the behavior of their family members or friends. It also studies the relationship of gender and to what extent social stigma affects their lives. In the study, there was a total of 2,196 patients who were diagnosed with tuberculosis, and out of that number, only 1,977 were interviewed. In the results, there wasn't any stigma at the family level. The patients were supportive, nor was there any stigma at the work level. However, there were less female patients who shared information with their family and shared information with colleagues as well as their employers. Although overall there was an amendment observed at societal level with 60% of the patients hiding their disease from their friends and neighbors. Moreover, the stigma was observed to be among females. There was a different study where it had received opposite results. Out of 350 patients, a third of the patients were reluctant to attend social events and experienced negative reactions from family members. For example, a woman didn't want to reveal her daughter's illness due to the fact that difficulties may arise in marriage. Whether it is tuberculosis or other disease, patients are hesitant whether or not to disclose their status to family or friends due to the fear of rejection. There are two types of stigmas that were presented in my research. One is called enacted stigma, which is characterized by prejudicial attitudes and discriminating behavior directed towards individuals with illness. The other is called perceived stigma, which is the internalized by the mental health sufferer of their perception of discrimination. The reason why patients who are ill are stigmatized is because people view the illness as fatal and they don't want to contract the disease. Some think that diseases were self-inflicted among the patient and perceived as for having it. Some diseases such as HIV are associated with behaviors that people disapprove of, such as sex or drug use. Stigma can cause a huge impact on the patient and be a barrier to a patient's quality of life. The prejudice and fear caused by stigma may prevent people from coming forward and seeking the help they need. Stigma can also stop people offering help or being supportive. Stigma often inhibits people from getting the jobs they are qualified to do, and it can prevent people with health problems from playing an active role in their community. It can also affect a person's self-esteem and give them a loss of hope. Stigma can be used to exclude and against people, which in turn can lead to detrimental effects, such as the health and lives of the people who are being stigmatized. Because of this, it is important to stigmatization. One strategy to reduce stigma is protesting. Protest highlights the injustice of stigma and appeal for people to stop thinking or behaving in stigmatizing ways. Another strategy is education. Keeping people informed about these types of illnesses replaces inaccurate stereotypes with new information. Lastly, direct contact with people with health concerns results in improvements in attitudes about diseases. In conclusion, stigmatization can be hurtful and isolating and can lead to detrimental effects on the patient. Stigma can not only affect social relationships and the well-being of the patient, but it can affect the patient's health as well. In order to reduce stigma as a society, we must become informed about illness and cause of Society should work together to eliminate stigma because if not, it can affect patients' quality of daily living. So for my question for you guys is, if you were diagnosed with an illness, would you keep the diagnosis a secret or tell others and risk being socially rejected? Why or why not? What are some strategies you think you can reduce stigma?